Hello friends, today I will be talking about my article here, which is Emergency Nurses' Attitudes Towards Barcode Medication Administration. The purpose of the study was to assess emergency department nurses' attitudes towards barcode medication administration, also known as BCMAs. Identify barriers to BCMA implementation and its impact on workflow efficiency and medication safety is also a purpose of the study. BCMAs, we'll get into this and we'll explore the study goals, research methods, findings, implementations for all nursing practice. BCMA has been shown to improve patient safety by reducing medication administration errors, making it a crucial topic for discussion in emergency department settings. This technology ensures that the right patient receives the right medication at the right time, significantly minimizing risk associated with human error. Despite its benefits, some nurses may experience challenges in adapting to BCMA due to workflow disruptions or technical difficulties. Understanding their perspectives is essential in identifying barriers and finding ways to enhance the system's efficiency. This study aims to prove insight on how emergency nurses perceive BCMA and whether they find it helpful or burdensome in their daily routines. Additionally, it sheds light on potential areas for improvement in training and implementation strategies by examining both the advantages and challenges of BCMA. We can work towards optimizing its use in high-pressure emergency settings. Ultimately, this discussion will highlight the importance of balancing technology and practical nursing care to ensure the best outcomes for patients and healthcare providers alike. So a little background for you guys and kind of what's already known. MAEs, also known as medication administration errors, this is a very significant cause of patient harm and can lead to multiple adverse drug effects. BCMA has been widely adopted in inpatient settings and has reduced MAEs by 90.4%. So drastically. The 5 rights of this medication, as I spoke of earlier: right patient, right medication, right time, right dose, and right route. This is all very important in making sure that we're preventing the MAEs. BCMA enforces these checks, but it does add extra steps to medication administration process. So a little bit of a hinder. Emergency departments operate under different conditions than inpatient units, which requires fast-paced decision-making. Nurses' acceptance of technology and leadership support influence BCMA success. Some nurses find BCMA time-consuming in high-pressure environments, which is totally normal. Previous research suggests that training and workflow optimization improve BCMA adoption. So in my opinion, this research was necessary because there was limited studies on BCMAs, especially BCMAs in EDs. Understanding nurses' attitudes can really help improve implementation strategies of BCMAs, also addressing barriers that can enhance patient safety and workflow efficiency. So we're going to go ahead and dive into the studies and methods and findings. We'll go ahead and discuss existing research on BCMA, which is a significant patient safety concern, and BCMA has been proven to reduce these errors. However, emergency departments pose unique challenges compared to inpatient settings, as we said earlier. Fast-paced workplace. The study aimed to understand nurses' attitudes towards BCMA and to address implementation barriers and to improve workflow efficiency. So the research design that they used for BCMAs is descriptive cross-sectional study using an online survey. The study subjects, there was 55 nurses, Canadian nurses, that were a part of the National Emergency Nurses Association of Canada. These participants had varying levels of experience with BCMAs. Majority of them had only 1 year or less with BCMA experience, so it was a new thing for all of them, for a majority of them. An online survey was distributed to eligible nurses. Data collection was conducted remotely via online survey platform. Participants answered questions about ease of use, efficiency, leadership support, and workflow integration. Data analysis procedures, they use the IBM SPSS software, which is used for statistical analysis. This helps researchers analyze data, identify trends, and generate reports in various fields. So now that we've taken a look at that, let's look how the research was conducted. This was a descriptive cross-sectional study using an online survey, as I said earlier. The survey was distributed to emergency nurses in Canada, and responses were analyzed using statistical software to identify trends in their attitudes towards BCMA. Understanding these methods helps interpret the study's findings accurately. The survey included both multiple choice and open-ended questions to capture the quantitative data and qualitative insights. Researchers focused on variables such as nurses' years of experience, frequency of BCMA use, perceived ease of implementation, as well as demographic factors that were considered to explore whether different groups of nurses had varying perspectives on BCMAs. The study aimed to gather a broad representation of emergency nurses to ensure diverse viewpoints were included. By using a cross-sectional approach, the researchers were able to assess attitudes at a specific point in time, providing a snapshot of current opinions and challenges related to BCMA adoptions. So a few positive findings that we had with this study was that most nurses found it very easy to use and it was not very intimidating. 67.3% of the participants had 1 year or less of BCMA experience. So although they did have the experience, they did find it a little difficult. They had positive attitudes toward like behavioral intent, self-efficiency, and anxiety reduction. But they also found some challenges with this. Many nurses did not perceive BCMA as improving efficiency. Neutral attitudes were found regarding social influence and leadership support. Also, some nurses felt BCMA added extra steps, slowing them down in the fast-paced unit of the ED. While these results were insightful, most nurses found them easy to use, like I said, and not necessarily believed it improved efficiency. Like I said, very easy to use, but didn't improve efficiency. Many participants didn't have very much experience with this, or many participants had limited experience with this. Leadership support, workflow integration were identified as key factors in successful BCMA implementation. Some nurses expressed concerns about the system slowing them down during high pressure situations, which can impact patient care. Others highlighted the importance of proper training to ensure smooth adoption and minimize resistance. The study also revealed that technical issues such as scanner malfunctions or connectivity problems could contribute to frustration among users. Despite these challenges, many nurses acknowledged that BCMA played a crucial role in reducing medication errors and enhancing patient safety, which is the ultimate goal. Moving forward, addressing these concerns through better system design and ongoing support, I think, will be very essential in maximizing BCMA's effectiveness in emergency settings. The researchers concluded that while BCMA is generally accepted by emergency nurses, concerns about its perceived inefficiency remain a significant challenge. Many nurses acknowledge its benefits in reducing medication errors, but express frustration with the workflow disruptions, the technical limitations. Leadership support, proper training, and seamless workflow integration were identified as crucial factors in improving BCMA's adoption and usability. Without these elements, resistance to the system may persist, limiting its overall effectiveness in emergency settings. They also highlighted the need for ongoing evaluation, refinements to address specific barriers such as scanner malfunctions and time constraints, especially during high pressure situations. Further research is recommended to explore the long-term impacts of BCMA on patient safety, nurse efficiency, and overall healthcare outcomes. Additionally, future studies could investigate how tailored implementation strategies and enhanced user training might improve nurse satisfaction and system effectiveness. By continuously assessing and refining BCMA integration, healthcare organizations can ensure that the technology supports rather than hinders the critical work of emergency nurses. So I found that this study to be important because it highlights the impact of BCMAs on patient safety and efficiency in emergency departments, where accuracy and speed are critical. The findings emphasize both the advantage of BCMAs in reducing medication errors and the challenges nurses face in adapting to the system. However, the study's small sample size, small sample size and limited experience with BCMAs among participants suggested that the results may not fully represent the broader nursing population. Further research with larger and more diverse samples is needed to gain a deeper understanding of BCMA's long-term effects on nursing workflows and patient outcomes. Also, addressing nurses' concerns such as system usability, training gaps, and technical issues will be essential in improving adoption rates. Optimizing workflow integration through better design and institutional support can help ensure that BCMA enhances efficiency rather than becoming a barrier to timely patient care. By refining implementation strategies and incorporating nurse feedback, healthcare organizations can maximize the potential of BCMAs in emergency settings. So, in conclusion, BCMA has demonstrated its effectiveness in reducing medication errors, however, making it a valuable tool for improving patient safety in emergency department settings. Challenges such as perceived inefficiency, workflow disruptions, and technical limitations continue to impact its seamless. However, challenges such as perceived inefficiency, workflow disruptions, and technical limitations continue to impact its seamless integration into daily nursing practice. My apologies. Addressing these concerns through comprehensive training, stronger leadership support, and continuous system improvements will be essential in maximizing its benefits. By refraining implementation strategies and incorporating user feedback, healthcare organizations can ensure that BCMA enhances both safety and efficiency without adding unnecessary burdens to nursing workflows. Thank you for your attention, and I look forward to discussions on how BCMAs can be further optimized in emergency care settings.